So Dr. Pruthi, thank you so much for spending a little bit of time with us this morning. We are looking forward to the ASH conference next week, where we're going to be hosting for the fourth time a symposium before the show. What are some of the highlights that you're looking forward to for that symposium?
So this is, as you said, the fourth year we're doing this symposium. What's different this year is, rather than focusing on malignancy and coagulation disorders, we're focusing on coagulation disorders. There's a variety of topics one could cover. Within the time limits that we were given, we, based on the feedback provided to us over the last 3 years, we picked some topics to cover. What we learned over the last 3 years is that the audience really wants basics. ASH is a wonderful meeting. We can get very advanced in very different number of topics, but our audience, and part of our audience are clinicians in practice, and they're interested in the basics. So that's what we decided to cover today at this session. So what's on the agenda is we kick off by Dr. Nichols, who's our former director of the coagulation lab, talking about how to evaluate abnormally prolonged PT and APTT. It might seem like a simple topic, but yet it can get very complicated. And he will highlight Mayo Clinic's algorithmic approach on how to evaluate the clotting times. That provides a cost-effective, value-based guideline as to how best to evaluate the laboratory abnormalities. And that session will be followed by Dr. John Haidt, who's actually now an emeritus professor. He was our former director of our coagulation laboratory and coagulation disease-oriented group. He spent his career researching the epidemiology and the laboratory epidemiology of patients with venous thrombosis. So he's going to give us a high-level view of how, who, and when to do thrombophilia testing in patients with and without venous thrombosis. And then I follow, and I'm currently the Special Coag Lab Director. One of the new things that clinicians are faced with is the newer anticoagulants.
Okay.
And that's been a tremendous benefit to our patients, but it has posed some challenges to the coagulation laboratory, because patients who are on these oral direct-acting anticoagulants, and if their providers order special coag tests on them, there are some results that can be these direct-acting anticoagulants confound interpretation of these tests. So I'll be highlighting some practical aspects of how to interpret coagulation testing in patients on direct-acting anticoagulants. And then Dong Chen, who's a co-director with me in the Special Coag Lab, will talk about the Mayo Clinic's algorithm on approaching laboratory testing for von Willebrand disease. Now that's congenital von Willebrand disease, but also acquired von Willebrand syndrome. And he'll be sharing some of the research that he has done in this area. We're fortunate this year to have a guest faculty. Ilona Turley was our Special Coag Lab fellow, who's now on staff in Edmonton in a big hospital. And she'll be talking about lupus anticoagulant, overview of lab diagnosis using case-based studies, highlighting the importance of pre-analytical and analytical aspects of lupus anticoagulant testing. And last but not least, patients with cancer frequently experience coagulation problems. And if we don't recognize these associations, patients can experience significant morbidity. So Dr. Anila Shrani, who's the director of our Special Coagulation Lab Fellowship and the chair of our education group, will be presenting on a very case-based and very practical approach on how to diagnose and, recognize and diagnose coagulopathy associated with malignancy.
So it sounds like a very busy morning. Can you give attendees kind of a preview of what the morning's like and the pace of it, where it's located, how they can access the symposium?
Our presentation precedes ASH on Friday, December 2nd, and it'll be held at the Manchester Grand Hyatt in the San Diego in the Coronado Ballroom. And so it's at 7 in the morning, and it's going to be a very busy morning. But our presenters are very skilled at following a pace of presentation that's very friendly to the audience.
And attendees can come and register that morning. We do encourage attendees to go to our website and register for it, but if you decide at the last minute to come attend, they can do that still, right?
Yes, absolutely. In fact, we were so successful in attracting attendees over the last 3 years that we had to turn people away because of the fire code in the room. So we would really encourage people to register online. But by all means, if you're not able to do so, to come in the morning and register at 7 a.m.
Very good. So ASH itself is a huge conference. I marvel every time I go there how big it is, how the diversity of subjects that are covered. I guess overall, what are you looking forward to most about attending ASH?
Overall, I think ASH is a wonderful meeting. As you said, it is very diverse. It covers a broad variety of topics ranging from benign hematology all the way to malignant hematology. But I think the organizers are so skilled at spacing out the different sessions, and the education sessions are superbly presented by very skilled presenters, that there's something for everyone when you attend ASH.
So I know your laboratory is very active in test development and really trying to tackle many of the big questions that hematologists have, especially in bleeding disorders and coagulation. What are some of the tests that you really want to talk to attendees and hematologists about, really what we're seeing, what we want to accomplish with testing, and more importantly, how we can partner with hematologists to take care of our patients?
The evaluation of the patient with a bleeding disorder is extremely complicated. Part of the complexity is that testing for bleeding disorders involves testing patients' plasma, which can be collected, processed, frozen, and shipped to a reference laboratory. But more importantly, testing patients' platelets. That is not easily shipped to a reference lab.
Okay.
You really need fresh platelets on site to get a reliable testing. So what's unique is this is one of Dr. Chen's passions. And ever since he joined us on staff, he took it on himself to develop and validate platelet function tests that could be shipped in. So one of those tests are highlighted is the development of the platelet flow cytometry. There's a limit as to how many days the sample can be traveling to us, but we've had very good success in having platelets shipped to us for platelet flow cytometry.
Okay.
The second test that he's validated and developed and spent a lot of time validating is the electron microscopy. So with that, we're able to diagnose some very rare bleeding disorders like Hermansky-Pudlak, dense granule deficiency, or alpha granule deficiency states. For those tests, platelet aggregation studies are not always accurate. So the electron microscopy is the gold standard.
Oh, very good.
And that's been a real valuable addition to the repertoire of tests we have for the diagnosis of bleeding disorders.
So what are some of the key questions that hematologists may have about those tests?
Some of the important questions that arise from having this repertoire of tests is who would you test and when would you test? Certainly if patients are on antiplatelet agents like aspirin or nonsteroidals, you shouldn't be doing those sort of tests. But if they're not and the patient has bleeding symptoms, what degree of bleeding symptom do you need to do these tests? So that's part of the research that we're currently doing to make it a very cost-effective test. And then shipping the sample to us is extremely important because there's a finite time period from collection of the sample to us receiving it to get the optimal results.
Very good. Well, thank you so much for your time this morning. We're looking forward to the symposium and learning more about what's going on in the hematology space, and we'll see you in San Diego.